Wondering how to use the test device?
With the diversity of new COVID-19 variants, infections can happen rapidly and sporadically. If you are worried about being infected, the Salixium COVID-19 Rapid Antigen Test Kit enables self-testing of COVID-19 antigen to be done at home. Do not eat, drink, chew, or smoke for at least 30 minutes before the test. Clean the test area and wash your hands thoroughly with soap and warm water. Then follow these easy steps. Check the test kit including the expiration date. The complete test kit contains 5 components, including test kit in foil bag, extraction buffer tube and dropper, 2 disposable swabs in sterile packaging, disposable waste bag, and user manual. Remove the extraction buffer tube. Press and insert the tube into the tube holder provided on the top of the box. Remove the aluminium foil from the tube. Do not spill the liquid. Remove a swab from the sterile package and avoid touching the end of the swab fabric. Swab the fabric tip on the inside of your left cheek, which is the area between the inner cheek and the gums. Rub it up and down 5 times. With the same swab, repeat this step on the right inner cheek, and then rubbing left and right on the palate of your mouth 5 times. Make sure the fabric tip of the swab does not touch the tongue and teeth. Insert the swab into buffer tube. Remove the other swab from the sterile packaging. Insert the end of the swab gently into one of your nasal cavities, about 2 centimeters deep. After that, rotate the swab around the inner wall of the anterior nasal and make 5 complete rotations. Then, repeat the same step on the other side of the nose. Do not insert the swab too deep. Thoroughly soak both swab tips in the buffer and stir for at least 10 times. Squeeze the liquid from both swabs to gather as much of the solution as possible in the tube. Remove and discard the used swabs into the supplied waste bag and zip the bag securely. Fasten the dropper cap tube tightly, tape the tube and mix the sample solution thoroughly. Tests should be performed immediately once your sample is collected. Gently tear the foil pouch and remove the test device. Place the device on a clean flat surface. Add 2 drops of the sample solution into the sample well. Make sure there are no air bubbles. The sample will start to absorb up the membrane. After dropping the sample solution, check the test result within 10 to 15 minutes. One colored line appears in the control zone, C, and no colored band appears in the test zone, T, within 15 minutes. This means that no SARS-CoV-2 antigen was detected, and you are unlikely to have COVID-19. Continue to follow the guidance from your local state or territory health department for guidance when contact with others as you may be infected. If symptoms continue, repeat the test after 1 to 2 days, as SARS-CoV-2 antigen cannot be precisely detected in all phases of an infection. Positive result: 2 colored lines appear, with 1 colored band in the control zone, C, and another in the test zone, T. Note: the test is considered positive as soon as even a faint line appears within 15 minutes. Important: look very closely, the color intensity in the test region will vary. Any faint colored line in the result window should be considered as positive. Positive results mean that SARS-CoV-2 antigens were detected in your sample, and you are likely to be infected and presumed to be contagious. Refer to your relevant health authority and please follow the guidance from your local state or territory health department for guidance on confirmation testing if necessary, and if unwell, seek medical assistance. Invalid result: if no colored lines appear in the control area, C, within 15 minutes. The test is invalid, even if there is no line in the test region, T. Retest using a new swab sample and test cassette. Invalid result indicates that your test has experienced an error and is unable to interpret the result of the test. Insufficient sample volume or incorrect handling are the most likely reasons for an invalid result. You will need to perform a new test with a new rapid antigen test kit. If you still have symptoms, you should self-isolate at home and avoid contact with others prior to the retest. Collect all components of the test kit. Insert them in a bio bag provided and place them in general waste. Thoroughly wash your hands again with soap and warm water. Get Salixium now. Together we can end the COVID-19 outbreak. Test yourself, protect the community. Please contact your relevant authority for advice.